I believe that today the Occupational Safety and Health Administration is taking action that will protect thousands of working men and women who are exposed to benzene on their jobs. We are issuing an emergency temporary standard to reduce worker exposure to this highly toxic substance, which human experience tells us is leukemia causing. There can be no doubt. The evidence is in, and it clearly indicates that we need to reduce the exposure level to this toxic material. We need to protect workers. This emergency temporary standard will protect workers in the chemical, printing, lithograph, rubber, paint, varnish, stain remover, adhesive, and petroleum industries. We have moved to reduce worker exposure from 10 parts of benzene per million parts of air, 10 ppm, to 1 ppm, based on an 8-hour average. The new standard also reduces the present ceiling level of 25 parts per million to 5 parts per million, and eliminates the peak level of 50 parts per million for any 15-minute period during the 8-hour day. This emergency standard requires, in addition, that measurements of employee exposure be made, personal protective equipment and clothing be provided, employee training be instituted, medical surveillance be instituted, and adjustments in work practices and record keeping be made. As I've said, I believe that informed workers and employers are the key to a safe and healthy workplace. There, for the first time, I believe, in the history of OSHA, we are issuing with this standard what we consider to be a simple and understandable guide for employees and employers to follow in setting up better work practices and other safeguards that this simple statement will supplement the official language of the standard. The emergency standard does not apply to retail gasoline stations or establishments where the only benzene present is in liquids or mixtures of liquids containing less than 1% benzene by volume. OSHA's current standard of 10 parts per million continues to apply in those places. These establishments, however, will be considered for inclusion in the final standard. Although my first major action as Assistant Secretary deals with a specific substance, this is not going to be OSHA's only approach in the future. We plan to issue standards which deal with whole families of chemicals as well as single substances. Finally, I want to join Secretary Marshall in pledging that the Occupational Safety and Health Administration will, as this action I hope demonstrates, begin to focus our attention and our resources on the major serious health hazards that affect thousands of American workers each day. This is only the beginning. There is much more to be done as we strive to fulfill the mandate of the law to assure every American worker a safe and healthy workplace.